If you've been watching the news or scrolling through social media, you may have come across some alarming headlines about big changes for Medicare in 2026. Don't panic. This video will break it all down clearly and calmly. You'll learn what's changing in Medicare, why it's changing, and what you can do now to prepare. Let's start with the basics. Here's what you can expect. The Medicare Part B premium is likely increasing from $185 a month to $206.50 per month. The Medicare Part B deductible is likely rising from $257 to $288. The Medicare Part D drug deductible will be capped at $615, and the out-of-pocket max for Medicare Part D drugs will be $2,100. If you're struggling with medication costs, check out the Extra Help program. Income limits increased last year, so even if you didn't qualify before, it's worth checking out again. Please see the link in the description for more information. If you have a Medigap plan, also known as a Medicare supplement, you are well aware that rate increases this year have been higher than in the past. If you have a Medicare Advantage plan, you've probably already seen that some plans will be eliminated for 2026 and benefits may be scaled back. That brings us to the question of why. Why are there changes to Medicare for 2026? Most of the changes are due to legislation at the federal level. The law that continues to have the biggest impact on Medicare changes is the Inflation Reduction Act of 2022. This is the law that capped Medicare Part D prescription drug out-of-pocket costs at $2,000 for 2025 and gave the government the ability to negotiate drug prices with manufacturers. This legislation was passed in 2022 and went into effect in 2025. During the years between passage and implementation, there's been a perfect storm of higher than normal inflation, medical inflation that was even higher than regular inflation, and higher medical utilization. More people are getting more medical care more often. Medication costs are driving a lot of the increase in medical spending. There are more people taking very expensive medications than before, with weight loss drugs like GLP-1s contributing to a lot of that cost. Here's how that medication spending creates a problem with Medicare. Since Medicare beneficiaries have their out-of-pocket Medicare Part D drug costs capped at $2,000 this year and $2,100 next year, that means the costs beyond that amount for medications are paid by the insurance companies. In 2024, the insurance companies warned the government that they would have to significantly increase their premiums on standalone Part D drug plans to cover the extra financial risk from expensive medications. The government stepped in and gave the insurance companies subsidies through the Medicare Part D Premium Stabilization Demonstration Program. This was designed as a 3-year program. The subsidies for 2026 are going down from the 2025 levels, which will likely lead to an increase in premium cost for Part D standalone policyholders. How much are those Part D premiums increasing? We don't know. For the first time ever, the government rejected the bids from the Part D insurance companies because they were too high. It's likely that we won't know until October 1st what those standalone Part D premiums will be in 2026 for most companies. Did the Inflation Reduction Act's $2,000 cap help people with drug costs? Sort of. It helped about 8% of people on Part D plans who had extremely high drug costs in previous years. However, the other 92% of people on Part D plans generally had higher costs than in past years through higher premiums, higher copays and coinsurance, and issues with medications being removed from coverage on their Part D plans. Also, due to the increased costs to insurance companies from that $2,000 cap on medications, almost all standalone Part D plans eliminated agent and broker commissions in 2025, which leads to having fewer professionals available to help people find the right Part D plan. Agents and brokers can't spend lots of hours during the very busy annual enrollment period helping people find Part D plans for no compensation. And beyond the loss of income, agents would be taking a liability risk by being the agent of record on a Part D plan that they are not being paid for. That's why we're in this situation. More importantly, what do you need to do? Standalone Part D. If you have a standalone Part D plan, read your annual notice of change, also known as an ANOC. Your insurance company will send you this document in September. It will tell you how your current plan is changing in 2026. Here are things to look for. Is your plan ending at the end of 2025? If so, you will need to find and enroll in a new plan to keep drug coverage. What is your plan's 2026 monthly premium? What is the deductible? Are your drugs still covered by your plan? What will the costs for your medications be in 2026? Once you know that, you are ready to compare your current plan to all the others available in your county for the new year. You can do that starting on October 1st, and you can make plan changes between October 15th and December 7th. The video linked above walks you step by step through how to quote and enroll in a standalone Part D plan on your own. What about Medicare supplements, also known as Medigap plans? Medicare supplements are not affected by the annual enrollment period. They are month-to-month insurance policies that, at least in theory, can be changed anytime during the year. You will not get an annual notice of change for your Medigap policy. Many people with Medicare supplements have had higher than normal rate increases this year for the reasons outlined earlier. You can receive a rate increase notification from your insurance company at any time. When you get a rate increase notice, that's the time to comparison shop other available Medicare supplements to see if there is something better available. If you are in relatively good health, you will be able to change your Medicare supplement by going through health underwriting. The health underwriting is just a list of questions. The insurance companies are looking for expensive to treat and serious chronic conditions. If you don't have any, you will likely be able to buy a new Medicare supplement at a lower cost. If you do have a medical condition that would be a problem for Medigap underwriting, you may have a guaranteed issue right or birthday rule that you can use to buy a new policy without going through underwriting. Guaranteed issue rights vary from state to state. If you are buying a new Medigap policy, here are a couple things to know. The old 12-month rate guarantees are mostly gone. Insurance companies are no longer promising to keep your application price for the first year that you're on the policy. In many states, you can plan on having a rate increase before your policy's anniversary date. Not all Medicare supplements are available by guaranteed issue. The most glaring omission in the national guaranteed issue right list is Plan N. If you want a Plan N, you will have to pass health underwriting in most circumstances. If you use guaranteed issue or a birthday rule to purchase a new policy, you might lose your agent or broker. Only the states listed on the screen require Medicare supplement insurance companies to pay commissions to brokers and agents for guaranteed issue policies. In some of these listed states, the payment to agents is just a small nominal fee. In all other states, insurance companies don't have to pay agents or brokers for guaranteed issue business, and most of them won't. Just like with Part D plans, it's not a good idea for an agent to write policies and take on the liability for servicing those policies when there is no compensation. People who live in Arizona, Oklahoma, Texas, Ohio, New Jersey, and Washington who have original Medicare Parts A and B and Medicare supplements will now have prior authorization through original Medicare for some procedures. There's a link in the description that will give you the full list of medical services impacted. This prior authorization rule only applies to 17 outpatient procedures. These were chosen because they are vulnerable to fraud, waste, and abuse. Anyone getting these medical services for a legitimate medical reason should not have a problem accessing care. If this program goes well and does cut fraud, waste, and abuse, will it be expanded? Yes, I think there will almost certainly be more prior authorization in original Medicare in the future. There's a massive amount of money lost to fraud, waste, and abuse every year. In 2024, over 7% of original Medicare spending, which equals over $31 billion, was spent on improper payments. The other looming problem is that the Medicare Part A trust fund is projected to be depleted by 2033. The fraud, waste, and abuse have to be cut if the Medicare program is going to continue. What if your costs for a Medicare supplement plus standalone Part D plan have become unaffordable? This happens every year. People who have had a Medicare supplement and standalone Part D plan, sometimes for a long time, either find the premium increases have gotten to be more than they can afford, or if they're pretty healthy and don't use medical services, they're just tired of paying that much money to an insurance company and not seeing any benefits. If you are in that situation, the annual enrollment period, October 15th through December 7th, is when you can look at Medicare Advantage plans in your area. Medicare Advantage plans are not right for everyone, but if your standalone Part D and Medigap costs have gotten very high, Medicare Advantage could possibly be a good alternative to save you some money. I recommend having an agent or broker you trust assist you with the quoting for Medicare Advantage plans. Someone with a long history of working with Medicare Advantage plans will be able to guide you to plans that will really work well for you, not just the one that may look the cheapest or have the flashiest extras. What if you have a Medicare Advantage plan? Like Part D plans, Medicare Advantage plans are annual policies that are affected by the annual enrollment period. Also, like Part D, the first thing you need to do is read your annual notice of change. Your ANOC will tell you if your plan is being continued in 2026 and what changes are being made to it. Some plans are renamed every year. If your plan has a new name, that doesn't mean that it's ending. Here's what to check. Every plan has a plan name and a plan code. That's a string of letters and numbers after the plan name. If your plan code is the same for 2026 as it was in 2025, your plan is not ending even if the name is different. It's just been renamed. If your plan is being terminated, you must choose a new one. You will not automatically be enrolled into a new Medicare Advantage plan. If your plan is being eliminated, you have longer to make a plan decision. You have until December 31st to choose and enroll in a new Medicare Advantage plan. You have a special enrollment period that is granted to everyone who is in a Medicare Advantage plan that is leaving the market. If you do nothing, you will have only original Medicare Parts A and B beginning on January 1st. No drug coverage and no protection from original Medicare's out-of-pocket costs. Your special enrollment period technically runs through the end of February, but going through January and February with only original Medicare is not a wise risk for most people. So my advice is set a deadline for yourself of December 31st to enroll in a new plan. You can also move to original Medicare with a Medicare supplement and standalone Part D plan during the annual enrollment period. If you are healthy, you can do this through medical underwriting, whether your Medicare Advantage plan is being terminated or not. However, if your current Medicare Advantage plan is ending, you will have a guaranteed issue right to purchase some Medicare supplements without underwriting, although with the possible guaranteed issue complications mentioned earlier. If your Medicare Advantage plan is continuing in 2026, here are things to check in your ANOC. Monthly premiums, health and drug deductibles, co-pays and co-insurance amounts for medical services and prescription drugs. Make sure your doctors, hospitals, and other medical professionals are in your network for 2026. Check out the out-of-pocket maximum limits for both medical coverage and drug coverage. Will you need referrals to see specialists, and are there any changes to prior authorization for the new year? Check your drug costs and whether your medications are going to be covered in 2026. Check on any changes to extra benefits that are important to you. Once you know the changes to your plan, you can compare that plan to all others in your county beginning in October. Because these plans change every year and some enter or leave the market, there may be a better option for you in 2026 than what you had in 2025. Medicare Advantage trends for 2026. Medicare Advantage plan trends are not necessarily nationwide. The market for Medicare Advantage plans really varies from place to place. Some Medicare Advantage plans are leaving some markets. This happens every year. It does not happen everywhere. As explained earlier, if your plan is ending, you will have a special enrollment period to choose and enroll in a new plan. If you have an agent or broker, that person should be contacting you, in addition to the insurance company, to make sure that you have coverage for 2026. If you like your agent, make sure that you go through that person to sign up for a new plan. If you take a call from the insurance company or a call center year and enroll in a different plan, you will likely lose your agent and any assistance that person provides you. You will have no advocate with the insurance company if you have billing issues or problems with prior authorization or any other service issues during the year. In general, it looks like there will be fewer PPO options in 2026. Again, this can be traced back to the Inflation Reduction Act and its extra costs to insurers. Insurance companies are cutting some less managed care plans like PPOs in favor of HMOs. Extra benefits are on the chopping block with Medicare Advantage plans every year thanks to inflation. And of course, the Inflation Reduction Act. Don't be surprised if over-the-counter dental, vision, and fitness benefits are scaled back or eliminated in 2026. As I said at the beginning, don't panic. There are some definite headwinds this year for the annual enrollment period, but we will get through it. If you are already a client of ours, you've received some initial communications regarding all of this. You'll be hearing from me more as we get closer to the annual enrollment period. If you don't have an agent or broker and are overwhelmed with the options, please feel free to give the office a call at 877-312-1414 or use the other contact information in the description. We'd be happy to help you. Our goal is always to make sure Medicare beneficiaries understand their coverage choices and make sure they are in the right Medicare plan now and in the future. Have a great day.